Hello everyone, this is Dr. Sino, and I'm here to talk to you about the coronavirus. Now there's a lot of information out there that's fake or that's real, and there's a lot of panic going on. So I did a lot of research on this subject in the past couple of days, and I have a lot of new information for you. So I hope this information does help you, and if it does, please share this video with all your friends because I really want to empower you and your friends on this subject. Now let me just give you a little bit of background about myself. So I'm a surgeon here at Montreal, Canada, and I studied at McGill and Harvard, and during my studies I was really fascinated with the physiology, especially virology and microbiology. Let's talk about what a virus is to start this conversation about coronavirus. Now think of us as human beings made up of building blocks. These building blocks are called cells. They're microscopic, we only see them in a microscope. Now think of this as the cell, this structure here. A virus is even smaller than what we're made of the building blocks. It's a small little dot, let's say, that comes in and infects the cells. Inside the cell it replicates and then it produces multiple other viruses. Now a successful virus does not kill its host. It actually replicates multiple more viruses. Now what's so special about the coronavirus? Now the coronavirus is a zootonic virus. Basically it has skipped species. We've seen it in bats, now it's become in humans. Now this is not the first time we've seen the coronavirus. It actually has been seen in 2003 called Sars. A lot of us have heard about this. Sars epidemic was contained mostly in East Asia. It affected people in 17 countries. Almost 8,090 people were infected and 700 people died. Interesting fact, that creates a 9.6% mortality rate. Now when we look at the COVID-19 virus now, that we called it 19 because we saw it in 2019, this virus has become a pandemic here now in 2020. It's infected people almost all around the globe. About 160,000 people are infected with it, and the mortality that's been reported is almost up to 6,000. So when you see the statistics, the mortality rate of the COVID-19 currently is 0.03% to 2%. So that's as low as 0.03% to 2% compared to the epidemic we had in 2003 was around 9% mortality. The problem is the incubation period. The incubation period of the COVID-19 virus is 14 days, and that's why we're seeing it spread more rapidly than the epidemic we saw in 2003, because the incubation period of SARS, if you want to call it SARS-1, was 4 to 6 days. So in the COVID-19, we're seeing that people are living their daily life without any symptoms for 14 days, spreading the virus around. And if you think about it, it's a very smart virus because it's doing what it's supposed to do. If you think about a virus, it's not supposed to kill the host cell, it's supposed to spread. And this COVID-19 is doing a great job in that. It's spreading because it's there for longer times than the previous virus. Now here is where it comes really interesting. The highest risk factor of COVID-19 is hypertension at 30%. The second risk factor makes sense, diabetes at 19%, and then we have coronary artery disease and older age. Now, if you think about viruses and the immune system, our immune system is there to kill viruses that we don't want or bacteria. Now, when we're immunocompromised, our immune system is weaker, like when we have diabetes or in the elderly population, it makes sense that we cannot fight that virus. But why is hypertension, high blood pressure, a risk factor for COVID-19? Especially since hypertension is a very common disease in North America and the Western world. Now, in the research that I've done, and this has been scientifically proven, that the coronavirus receptor to our cells is the ACE receptor, the angiotensin converting enzyme receptor. This ACE receptor ordeal with the coronavirus is probably related to why hypertension is one of the highest risks. So if you're living with hypertension, diabetes, coronary artery disease, or respiratory diseases, you are at more risk, and also if you're an older age group, above 65. So what is the treatment of COVID-19? The treatment is supportive. So what does that mean? We don't really have a medication. We can't pump in fluids or medications to treat the virus. We have to support the patient's symptoms. Now, the deaths that are occurring is because of multi-organ failure. So what's happening is a cytokine storm. When patients are being infected with this, especially with those comorbidities that I mentioned, they're having multi-organ failure. Their lungs are failing with acute respiratory distress syndrome, so they have to be put on a ventilator. When you have your liver failing, or you have your kidney failing, and even have your heart failing, we can't give a medication to treat all that. We just have to support the patients. And that's what the medical community is facing trouble with. So that's why what the best treatment is prevention. And how can we prevent this disease from spreading to the community, to our loved ones, and to ourselves? And it's basically, I'm telling you this, I'm reminding myself this, and as I teach my children as well, you want to make sure you wash your hands every time you touch something outside. And you want to do this all the time, not just now in the next 2 weeks. Also, you want to use the antiseptic solutions whenever you can. And if you are coming from a high-risk area of your travel, you want to self-quarantine yourself for 2 weeks out of courtesy for yourself and people around you. Now, what can we learn from all this? Healthy lifestyle is very important. This is your opportunity to live that lifestyle that you really want, because you want to prevent disease for yourself and people around you that you love. So healthy eating, you want to eat something with high antioxidants. Guess what? Fruits and vegetables, vitamin E, vitamin C, zinc, these are all proven to boost your immune system. Also exercise. There's multiple studies out there talking about exercise, endurance, how it helps to boost your immune system, and it makes it make you feel good as well. So a lot of gyms are closed out there, so do that exercise at home. Don't forget to do that. Thank you for tuning in. I really hope that you learned something in this video and you enjoyed it. And if you did, please share this with as many people as you want, because we really want to spread the word. We want to empower everyone around us. I will be sharing a lot of these references that I talked to you about at the end of the video. Stay tuned for our next video coming up soon.